Hey, welcome to my channel. This is Ken Foka here. I'm a Medicare specialist. I'm actually a licensed insurance broker, so I'm actually not tied to any particular licensed insurance company. And today I'm going to be having a very quick talk about Medicare Part D, which is the prescription drug coverage that you should get once you get eligible for Medicare. So I'm going to dive deep today and discuss Medicare Part D, which is basically insurance for seniors. Medicare is insurance for seniors and people who qualify through disability, and they're required to have a Part D or a prescription drug coverage besides their regular hospital insurance Part A and medical insurance Part B. So I'm going to discuss that Part D here and explain what you need to be careful about once you are eligible to get a Part D prescription drug coverage. Just like when you become eligible for Medicare, you should get your Part A and B and a D, which provides prescription drug coverage. I'm going to look at the costs for not having that, which of course is a penalty that Medicare would charge you. And I'm also going to discuss something also referred to as an income-related monthly adjustment amounts, or IRMAA, which Medicare would charge for people who make a certain level of income. So I'm going to discuss that as well here, because those all have an impact on what your cost for Part D or prescription drug coverage could look like. So let's dive deep in. Again, my name is Ken. I'm actually a Medicare specialist. I'm actually licensed in many different states across the nation. So I will be very happy to assist you. If you have any questions about Medicare and you're trying to, narrow it down as the deadline draws near, for everyone who is eligible to enroll for Medicare, they have that period between October 15th through December 7th to enroll into Medicare. And it's actually running to the wire right now. I'd say December 7th is the deadline for anyone who hasn't enrolled still to make that decision and go ahead and enroll. What I'll be looking at here today is basically talking about the Part D of Medicare. I'll do a couple of other videos for the other parts, but I want to focus today on the Part D, which is really the prescription part of Medicare. So if you are eligible for Medicare, which means you're turning 65, you automatically will be getting eligibility to get Medicare for all U.S. nationals and permanent residents. So anyone who is residing in the United States and legally resident or U.S. national would qualify for Medicare once you turn 65. Now, Medicare does have 4 parts as it's described. So I'm just going to briefly talk on that, and then we'll see how it comes down to the Part D, which is the prescription drug coverage, D as in dog, which is what I'm talking about today. So the Part A, B, C, and D of Medicare, I'm going to talk really quickly on those 4 parts, and then we'll focus more on the Part D. So the Part A is basically a hospital insurance, or when you would go into the hospital, all of that, and inpatient care and hospice care and all that stuff that has to do with going into a facility. Medicare covers the cost for that for you, and that is provided under your Part A for Medicare. Part B is practically your medical insurance. So when you go see doctors, specialists, anything that has to do with preventive services, right? Those things that will be medically required for anyone to stay healthy is covered under the Part B for Medicare. Now, Part C is a very confusing one that a lot of times people ask me, what is it actually? Do I have it? Do I need it? Well, it's kind of technical in a way. You might not need it if you have your original Medicare and you decide to use a supplemental plan as a complement to your Medicare original Medicare. Then you might not even need a Part C, because a Part C is technically what they refer to as Medicare Advantage plan. So it's a Medicare Advantage plan which incorporates your Part A, your Part B, and a Part D, which is prescription coverage. That's what we're going to focus our discussion here today on. Prescription drug coverage Part D. So you wouldn't have a Part A, B, and D. That's a requirement. For anyone who gets eligible to enroll into Medicare, you're required to have a Part A, B, and D. That's a requirement. So bare minimum is you have to have those 3. So typically when you get eligible for that, you would get that notice from SSA telling you that you're not eligible for Medicare, and you should do one of the following: go on and enroll, or you keep your original Medicare, which is Part A and B, as your primary provider care, as you are into that age group for Medicare eligible persons, or if you were disabled and getting that credit as well. So you would be required to have a Part A, B, which is provided to you by Medicare, but unfortunately Medicare does not provide a prescription drug coverage in itself. So they usually get that through private organizations or insurance companies. So you would want to make sure that you have a standalone prescription drug coverage if you decide to use your Part A and B, so that will complement it to make it a complete as is required by Medicare to have a Part A, B, and D. Now, that's why the Advantage Plus plans are very attractive, because under the Advantage Plus or Part C, you would have all three of them provided to you by the private organizations again, which would include a prescription drug plan inside. So that's what it's really all about, the Part C. So it has your A, B, and then they would add a D into that and make it what they call an Advantage Plus. So I'm really going to keep the discussion here on Part D prescription. So we'll look at it from what is a creditable prescription drug plan, right? That's really how Medicare describes it. Creditable prescription drug plan. So if you can have a prescription drug plan, you think, well, I know I have a prescription drug coverage and it's fine, I don't care, whatever. Well, you want to make sure that that plan is creditable according to Medicare standards. What does that mean? That means whatever that prescription plan provides, it should be qualified as creditable by Medicare. So to say it is good enough or better than what Medicare would provide, right? So if Medicare is providing, or what Medicare considers a standard for prescription drug coverage, they expect that plan to meet that standard. So that will be the bare minimum, that it meets that standard or it's better than the standard that Medicare sets. So if it doesn't meet those standards or is not better than the standard, then it's not creditable. So you want to make sure that in whatever prescription drug plan that you enroll in, it should be considered creditable by Medicare. Otherwise, you would still have the same problem, which is what we're going to discuss. When if you do not have a creditable drug plan, what can happen? We're going to look at that situation as well. So first thing, you want to make sure you have your Part D or prescription drug coverage. And what does that basically do? So prescription drug coverage simply means Medicare doesn't want you to, go without that, because if you were to, leave yourself with the freedom of choosing whichever, whenever, and how you would pay for your prescriptions, then the prices could be really, really, high, on the high side. So the idea there is, if they manage that, then they can bring the cost down a little bit, so that you would see what the companies or the private organizations offer as a tier. So there are 3 tiers basically, which are generic drugs, brand name drugs, and specialty tier drugs. So that's how most of the drug companies or the private organizations or insurance companies would offer their tier for the drug coverage for you. And that brand name of the first tier is the typical generic drugs, which are common in the market. So you don't have to pay too much for any prescription that you get that is at that tier or at that level of the generic level, right? So in most prescription plans, you would see that a generic drug will cost you less for co-pays or co-insurance, right? And once you move up a little bit into the brand name drugs, then you see that cost go up a little more, because brand names, as the name goes, is a brand name, right? So it means the price for that is a little bit higher. So your cost sharing for that is also going to be higher. And then when it gets to the worst case is what they call the specialty tier. So this is mostly with drugs that are just not available in the market. So maybe just one manufacturer of that drug, and they're asking still a very high price for it. So what Medicare has done in that case is they just use what they call a system specialty tier, whereby you, as the person who requires that prescription, will share the cost for paying for that drug with the plan provider, which is the private organization or the insurance company, and the manufacturer of the drug, right? So typically they will give you a percentage, which is usually somewhere between 25 to 33% plus or minus, depending on whichever plan you're on. But that's where around that number that you would be. Your cost sharing will be about 25% once you hit that specialty tier, which is usually what they would call a donut hole, right? It means your cost for prescription is just so high that you can afford it, and then they have to kind of bring in a system whereby you can, get some help to take care of that high cost for your prescriptions. So that's what that does basically. Make sure that you can still afford that prescription, though it's really expensive. Well, I mean, there's so much going on in the back end to bring down the cost for prescription drug, and I hope that the Congress will do something about it, because I think that's one of the most difficult part for being a senior and getting into retirement and having to spend so much of your income on your basically fixed income on prescription drug coverage. So I think that something really has to be done there to help the seniors as they retire and start needing all the drugs that they do to stay healthy throughout retirement. It brings me back to where I was trying to focus my discussion today, which is the cost, right? The cost for Part D when you do not take that enrollment once you become eligible, right? So if you were enrolling, so let's say you were becoming 65 on the first of your birthday month, you would have 3 months before then to enroll and become, to start enjoying the benefits of Medicare. At that point, also, Medicare would expect you to have Part D prescription coverage besides your Part A and B. Now, if you do not take that enrollment into a Part D plan, then you would have a penalty to pay, which is basically 1% of the national average for a prescription drug plan. So they will calculate the national average of a prescription drug plan, and then they will fine you a 1% of that amount, which is, I think for 2021 is to $33.06. So that will be 1% of $33.06, and for the year 2022 will be $33.37. So if you calculate 1% of that $33.37, that's what your penalty will be if you do not take a Part D prescription drug plan along with your Part A and B Medicare once you become eligible. So the cutoff limit is 63 days. So it means once you become eligible and you go for more than 63 days, right? Continuous 63 days. So you could have it and lose it and then have it back, then no problem. But if you go for conspicuous 63 days without a prescription drug coverage, then you would be eligible, you would be fined the 1% penalty by Medicare whenever you do get that prescription plan. Finally, they would use all that time that you've not had it and they penalize you for that. So it's a very important thing to keep an eye on and make sure you have that prescription drug coverage when you become eligible for Medicare, which will provide you a Part A and a Part B, but they would not provide you a Part D naturally. Sometimes they do it automatically with SilverScript, but for some areas it might not be applicable. So you're still required, or if you chose to do what they call original Medicare with a supplement plan, make sure you have your Part D standalone plan, just to make sure you don't fall into that penalty, which is money that you could be using for something really important rather than paying a penalty, right? In a retirement. The other thing that I want to talk would be about the income-related monthly adjusted amount. That's also something that would affect some people, right? Not everybody, but some people who have, the high end on the income ladder. So if you're making 163,000 to 500,000, you would have a $70 to pay as an income adjusted amount monthly, along plus your monthly premiums for Part B and a prescription drug plan. So those are three. Let's just list them one more time. So you have your Part D premiums, Part B premiums, plus your income related adjusted amount that you have to pay on a monthly basis, right? So those are very important things to keep an eye on for those who make up to $163,000 a year to $500,000 a year. Those those are very important things to keep an eye on. If you do not pay that, there is also a consequence for not paying that, which of course it means you'll be disenrolled and you can lose those benefits of retirement. So that's very important to watch it. Now, if you earn over $500,000 a year, that will be $76 and $76.40. These are quotes I'm bringing up from the plan from the year 2020-2021. So you might want to see what the current rates are from Medicare from plan year 2022. So once you have that, calculated and taken care of, make sure you add that to your Part B premium, your Part D premium, and the income related adjusted amount. You sum that up, tells you exactly what you can see as your monthly cost for Medicare on a monthly basis. For those who are on a Medicare Advantage plan or a Part C plan, then you would want to add that as well to your plan premium. So it's basically plan premium plus income related adjusted amount, because most of the Medicare Part C or Medicare Advantage plans do include a Part D prescription. So you don't have a premium as such, separate premium as such. And of course, if you have a supplemental plan for dental, vision, and hearing, you also want to make sure you're calculating that into your costs. So those are things that I think is very important as you get into Medicare. You want to watch those four things: Part B premiums, Part D premiums, Part C premiums for Medicare Advantage plans, and of course, if you have income-related adjusted amounts to pay. So given that you've also not made any errors to get into any of those penalties, right? If you do not get Part B, there is a penalty. If you don't get Part B as in boy, there is a penalty. If you do not get it in time. If you do not get the Part D as in David, there's also a penalty. So you want to avoid all those things that would all add up and take away that income that you could be using on some really important other stuff. So that said, I would just want to go back and say, but there are some exceptions, of course. Medicare does consider your employer provided or union provided coverage for prescription as creditable most of the time. So if you are still under employer provided drug plan, it's creditable, it's good. As much as it's considered a creditable drug coverage, is good. You're good on that end, right? But just make sure that once you lose or you get out of that coverage from a union or a group, you want to take on an independent or a private provided prescription, a standalone prescription drug plan is what I wanted to say. Or if you would prefer not to get to worry about much of that, the Medicare Advantage is your way to go, because it's just perfect that it provides you the Part A. It assigns your Part A and B and adds the Part D in there. So you don't have to be worrying about, I don't have this, right? That's why the Advantage Plus is really good, or the Part C is really good. So I really just want to wrap this conversation up today by talking about, those who have not enrolled, please do well to enroll. The time is running out. You have till the 7th of December to send in that enrollment. Otherwise, you'll be setting yourself up for a penalty, which you want to avoid, right? You want to avoid a penalty or not having the right coverage when the plan year 2022 starts on January 1st. So you want to make sure you get enrolled. If you do need help with that enrollment, I'll be right here. I'm always willing to help anyone who has questions just about anything regarding Medicare. I'll be very glad to assist in providing you the answers to those questions that you might have and looking at what is the best plan and option for you. So there is no one size fits all for Medicare. Everybody should have, something that works best for them. So it's really going to come down to what do you like, what do you want, what is going to work for you best. So my number, as you can see on the back here, is 888-569-9229. You can reach me anytime on that number, or you can also go on my website. That's www.lockaquote.com. That's my website. You can get some you can place a request for direct help for Medicare, or my Facebook page as well. It's Keng Licensed Insurance broker. That's my Facebook page. You could also get on there, and there's so much information there. I've done so many other live on Medicare. You can watch them or follow them on this channel from now on till the end of this enrollment period. I'll be doing them just to help our seniors, especially in a Thanksgiving spirit, to help them understand those things that really matter most to them, get them ready to, enjoy that retirement. And on that note, I want to say thank you so much for taking the time off to follow on my video here. And next time around, I'll be talking about the very important thing here, which is how to, make sure that you get the best out of a Medicare plan. That's what I'll be doing on that deadline day weekend, so that what you can expect when you go in there, especially in the last minute and trying to find a plan that works for you. I'm going to be talking about what are the things to look for in a plan that should work best and meet your needs, and then keep it affordable at the same time, right? So that's what my discussion will be focusing on next time. And it was a pleasure sharing this platform with you, and looking forward to, another wonderful time with you next time. Again, my name is Ken. I'm a Medicare specialist. I do help people with health and life insurance. So if you have any of those questions, go onto my website, localquote.com, or you can get me on all the social media networks. I'm Ken Forker, spelled Nkeng. And I will be very happy to assist you, answer any questions you might have to reduce that worry, right? Again, one more time, it was a pleasure sharing this wonderful platform with you guys. Have a wonderful Thanksgiving weekend. Stay safe out there. Bye now.